Hello everyone, this is Bob Browner with Community Coronavirus Update number 64. Today we'll talk about the big gamble, CDC school guidelines, travel safety, and another FAQ. Um, the big gamble I think is this race against time, and are we doing the right thing or are we pulling back too fast? The good news is on the pro side, we have very rapidly dropping COVID cases across the country and to some extent Nebraska. We've got an improving vaccine rollout, which is making me a little more optimistic, and more people wearing masks, which is the biggest reason for the drop in cases. We have not gotten anywhere near herd immunity yet. It's mostly because people are doing the right thing wearing masks for the most part. The con we have is that there are people, I think we're relaxing some restrictions a little too fast. We've made that mistake over and over again, and I think we may be making it again potentially. There's the pandemic fatigue, which is partly a long-term thing. This is a marathon, not a sprint. Uh, the new, more infectious vaccine variants is a big risk. We don't know how bad that's going to be, how much it's going to affect everything yet. So that's sort of a big, huge question mark, and some mixed messages about what's happening, which we'll talk about a little bit. And so across the country, this used to be a sea of red everywhere. So across the country, things are generally getting better. Here in Nebraska, we had a huge outbreak that overwhelmed our hospitals. Now it's been rapidly drawing, came back a little bit after Christmas and holidays, dropped again, maybe a little post Super Bowl dip here or come back here, but hopefully this will be a continued trend. But hopefully we don't level out and take right back off again. That's probably my biggest worry and the risk worry of a lot of public health professionals across the country. Just like the last week, don't get too cocky yet. We're still in a high risk area, so this is not the time to go back to normal, essentially. Vaccine rollout, we're still checkered. We've improving a little bit across the country. Nebraska, unfortunately, fell to near the bottom, although we're coming back a little bit. We're not as bad as we used to be. We've got 40 million people vaccinated with at least one dose across the country, increasing rates. The Biden administration wanted to get at least a million a day. Now we're at 1.67. Hopefully, we'll be over 2 million a day soon. The faster this goes up, the better. Nebraska was in the 50s. We're up to 45th out of 59 if you go based on first dose given. You may have seen the article in Omaha World Herald and Journal Star saying we're 33rd. I think that's because they're looking at the second shot, not the first shot. So some people are kind of picking their measure based on what they want. You may have seen that it looked like Ollie and I may have been arguing with each other a little bit. And I think it's just that we're answering different questions. I think we need to speed up our rollout. I think what Ollie is saying is we're doing a better job. We started out of the gate really well with our hospitals and fell flat on our face. Now we're getting back up again and running. So I agree that we are making a lot of progress, and not as much as I would hope, but people know me. I'm kind of an impatient perfectionist, so that's just me. Um, when they say 33rd, I think it's again because I think they're looking, if you look at specifically the second dose versus the first dose, you could say we're 33rd, or almost average. I actually think the most important one is your overall rollout. If you go to the New York Times, you can actually click on one shots, two shot, or doses used, meaning how long it sits there before it goes into an arm. And this is the one I think is probably, if I were going to pick one measure, I wouldn't pick that one or that one. I'd pick the doses used. That one we're 45th out of 59 with only 71% of our shots actually given. If you go by the state's website this morning, we still have that sort of almost 105,000 doses sitting there. If you look at our daily average over the last week, we're giving about 8,000, a little over 8,000 a day. That means we got 13 days worth that are sitting, and I think this should be down to below 7 days is what we really should be shooting for. So we're making progress, just not as fast as an impatient perfectionist like me would want us to make. And some good news, of course, that we haven't hit herd immunity anywhere except for potentially the nursing homes. And then I think this article from the World Herald was great. Henry Cordes has been doing, I think, producing some good articles with some great numbers. And we are seeing a huge drop in our nursing homes, both cases and deaths, most importantly. And so we are doing a good job in some areas, at least. The other big thing that came out last week was the CDC guidelines for schools. And I would say most of it's good except for two glaring problems. One especially I think deserves an F, but most of it's good. The overall is right that number one is the layered mitigation strategies in schools, which I think we've done really well in some of our Nebraska schools. Making sure that we follow the indicators of community risk is basically reflective of school risk, and so we can't forget it's not just a school thing. The community has to be part of this. But the other thing they talk about is testing for students and also vaccination for teachers, which are two issues, of course. The testing we definitely need to do. We have done one round in Lincoln, but we don't have the results yet, to my knowledge. And then vaccines for teachers. Hopefully, in the next few weeks, we'll be starting to get all of our teachers vaccinated. I don't think you have to wait to do that to open our schools, and of course we did, and we've had our schools open the whole time. If you go to the mitigation strategies, of course, it's universal and correct use of masks, and I would emphasize correct because that seems to be a big problem lately. Some of these other things we already know about and we're doing. As far as correct use of masks, Saturday morning, I was really irritated when I woke up to the front page in the newspaper, and here we have a basketball game, and you've got three nose commandos right on the front page of the paper, plus this guy doesn't even have it covering his mouth. And so, yes, we can open some things up, but people just got to wear their mask and learn how to wear it properly. This isn't that complicated, people, so please wear your mask appropriately. And so, like last week, we talked about Osterholm and some others talking about double masking. It's not just a double mask, it's a combination of filtration, fit, time, and risk. And so, when double masking, what people are typically doing is they're using a disposable mask and then covering it with a cloth mask. That probably is helpful because you've got probably pretty good fit plus added filtration, and I guess you get to accessorize if you're so inclined. KN95 though, you wouldn't need a double mask, for example, because the fit is so much better. The other thing to keep in mind, of course, is the time. Like if you're just running into a quick shop, there's not necessarily that much of a need, I think, for double masking. But if you're taking, let's say, maybe a plane flight, if you're a school teacher, for example, then you're got a whole day worth, then maybe double masking will make a lot more sense, especially if we get any new infectious variants coming in. And so correct use of a mask and the right kind of mask is also important. They do talk a little bit about testing, but I don't think they go into it enough. I do think we what we're doing now in Lincoln in particular, for example, I think is working very well. However, will it continue to work well if these get these new variants in, and when would we know and how would we know? Well, how would we know is if we were doing some surveillance testing, which we don't have in place in Nebraska yet. And so to me, I think they should have emphasized the need to start doing some surveillance testing in schools across the country. The other thing that I think is the most glaring omission in the CDC guidelines is their thresholds for safety. And just to confuse everybody, they're not in the same units as the measures everybody else is using. Most people use a rolling average, daily average. They use 100,000 over 7 days, which is a different way to calculate it. They use a different color scheme, which is confusing. And the thresholds, I think, are very much wrong. If you actually go, they link to a study in the Lancet in England where they studied rates of transmission in schools in June and July, but those rates of transmission were for some of these effective mitigation strategies we put in place. So they base these thresholds based on old data, and I think that data is just flat wrong. And so I asked Ted on our website to kind of and it's up there now, by the way, to say, okay, if we were to use those CDC thresholds, what would it look like? Well, if we were to follow those CDC thresholds, we never would have opened our schools, and we still might not have them open, when I think we've pretty much proven in Lincoln Public Schools and many areas of the country where we open schools that you can open schools safely with the right mitigation measures. So I don't know why they're using one totally new thresholds that aren't related to anything, that ignore all the evidence that we've accumulated since June and July. So I think the biggest problem with the CDC guidelines is I think they're using outdated thresholds, and it's just confusing the matters because it's enough of a problem that now you have the CDC with its own color scheme, the state of Nebraska with its own color scheme, Lincoln Lancaster County Health Department with its own color scheme, none of which lines up with what anybody else is using, and so it's just confusing everybody. The other thing is, why not look at Rhode Island? There's a great article in the New York Times. I'd highly encourage you to read this one about Rhode Island, where how they opened their schools. And I really was impressed with Governor Raimondo's strategy and why they did what they did and how they thought through it. It was kind of flashbacks because it sounded like, when reading the article, a lot of the discussions we had at Lincoln Public Schools. And so they did a great job. And one of the things they had that we didn't have in Nebraska is they didn't have organized state support like that, like Rhode Island had. And also they had testing from day one in the Rhode Island schools, which we still don't have organized in Nebraska yet. But still, Rhode Island proved that you can keep schools open safely, which they did, just like we did. So Lancaster County, our numbers using the color scheme that most people in the country use. These are based on the Harvard SAFRA criteria. We are continuing to decline. We're still in there, and this criteria, by this criteria, orange, hopefully headed toward this yellow and green level. So this looks good, at least in Lincoln and Lancaster County. And I think that, again, the fact that we've done so well, this is why our fatalities have been lower. So I think, again, we've proven that you can safely do things if you do them right. As far as the whole state, it's a little confusing because there was this huge blip a few days ago. A lot of that is Four Corners Health Department had a whole backlog of tests that apparently didn't get ordered, so it makes it a little hard to interpret what the state level numbers mean right now. If you look, the reason they're like over 300 per 100,000, which that's the highest ever, well, it's because they had this huge backlog that I entered, and it threw off the numbers, not just for them, but the whole entire state. However, if you look at just at Douglas and Sarpy County, they also had a little bit of an increase there as well. This could be a post-Super Bowl weekend blip, potentially. Hopefully that's just temporary, not going to be continued, and they'll have a resumption of their downward trend as well. So, we need to control spread because, we keep saying, every new infection is another roll of the dice for another more infectious variant. So yes, they could be coming in from Brazil or South Africa or United Kingdom, but they could be coming from Kansas or Cass County for all we know. So we want to stop as much spread as we can. And again, we do need to keep the face mask mandates in place. So multiple communities across Nebraska are just voting to continue based on city council. And of course, there's the statement from the UMC College of Public Health, again, echoing that yes, mask ordinances do work. And the common question I also get is air travel safe? And the answer is I'm not sure yet. There is now consistency on mask requirements. It's now a federal guideline. However, I'm not sure if that makes a difference for every airport. So a person I know who flies a bit, she said to me that her home base place is fine, but one of her connecting flights went through an airport where you wouldn't have even thought people knew there was a pandemic going on. And so masks alone, like I tell people a lot of things in public health, no one single intervention is enough. You need layers of intervention to be safe. So it's the Swiss cheese model. So masks is going to be helpful, and so I think even with other things, you should still be wearing a mask in the airplane until we're past new variants and rates are extremely low. There's other things like spacing and ventilation. I was disappointed that the CDC did not say something about testing. I think we should be at the point that we could do rapid testing between all flights. But how do you prevent variants from flying around the country? Well, let's make sure people negative before they get on an airplane. I'm not sure why it is so hard for us to get pre-flight testing. Just so we're already doing it in athletes at the collegiate and the pro level. University of Nebraska can do it for all of its students. Why can't we get on-site pre-flight testing before leaving? So the question is, would you go on a flight? And for me, my wife and I, our answer is now yes. Now the thing is, though, that we've both had the vaccine. So with a combination of both masks and the vaccine, I'm okay to fly. If you haven't had the vaccine, I'd be a little nervous, and that's why I think negative testing ahead of time would add a layer of safety that we really need. And so hopefully that will change in the near future, because there's a lot of doctors and nurses who've been working overtime for a year and haven't traveled anywhere. They could be spending money and helping the travel industry, hotels come back fast, but we need to make it safe if we're going to do it. So I wish they would take a look at this and develop a nice, easy way for us to have pre-flight testing, so that makes sure that everybody on that airplane doesn't have coronavirus in the first place and would quit spreading it around. Another FAQ we got, I think there's still a lot of misunderstanding around how the coronavirus vaccines work. And specifically with the Pfizer Moderna, it's a messenger RNA vaccine. And so you literally cannot get coronavirus from a messenger RNA vaccine. And so this is a question I got from somebody as an email for our info. And essentially the way to look at it is, the coronavirus vaccine, or the coronavirus virus, it has, it's an RNA virus, and that RNA, it needs all that RNA to make an instruction to make a copy of itself. The mRNA vaccines, though, are not RNA, they're a subset called messenger RNA. So what happens is when this virus infects your cell, it instructs your cells to make messenger copies from that RNA to make the pieces of the virus, which are then reassembled inside the cell, and then that causes the new virus to come out. The Pfizer and Moderna viruses, it's only the messenger RNA to make one piece of the virus. So it can't give you the virus because it only is telling your cells to make one piece. And it's making the spike protein, essentially. And the spike protein is what your immune system recognizes to stop the virus. So you get that vaccine, all it is a bunch of instructions to make spike protein. And when you make spike protein, you're literally making the same thing that an infection of coronavirus would also give you, that would create immunity. And that's what the beauty of this vaccine is. That one, it cannot give you coronavirus because it doesn't include the full instructions. One way I might explain it is like the Chilton shop manual I had when I used to own an old broken down Ford Mustang when I was young. And every time something would break, I'd get the manual and figure out how to fix something. And so it'd be like just the one page in the Chilton's manual that tells you how to replace the starter and nothing else. So you can't fix the car just by knowing how to replace the starter. And so the mRNA vaccine is kind of the same way. It's only enough to make the spike protein, nothing else. You make that, make an antibody response to it, and there you go. And that's also why the mRNA vaccine should be very safe. But it generates the same type of immune response, and that's why in the second dose you sometimes get a little sick and chills and stuff like that. So hopefully that'll answer some of these folks' questions, that you cannot get coronavirus from the mRNA vaccines. So beyond that, it's back to the basics. I hope we can keep our Nebraska deaths below 3,000. We're over 2,000 now, so basic control measures: wear a mask, avoid the crowds, keep your distance, and get vaccinated when your number is called. So hopefully this is helpful to you, and I'll be back probably next week with another update.